Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Lyme disease. The name Lyme came from the area in the state of Connecticut, United States. This is a disease caused by spirochete called Borrelia Burgdorferi. Spirochete are special type of bacteria. They have coiled appearance and they look like spring. It is transmitted through Ixodes tick bites. This tick is also called deer tick or heart tick. Infected people are often unaware that they are bitten by the tick. Mostly the nymph stays. Nymph stays is a stage in the life cycle of the tick. From the egg, then we'll get larva, then we'll get the nymph stage. From nymph, we'll get the adult stage. Mostly the nymph stage of the tick transmits the spirochete and should be attached to the body for 36 to 48 hours. Adult stage of the tick can also transmit the spirochete, but mostly the nymph stage. Lyme disease is endemic in North America, Europe, Russia, Mongolia, China, Japan. Even it has been diagnosed in Australia. It is diagnosed in around 35 states of the United States. It is also diagnosed in the state of Florida. It is a notifiable disease, and this disease is more common in northeastern part of the United States, maybe in the Midwest. It's also in California. Why it is more common in northeastern side? Because of more deer population. Deer is a host. Other hosts are the mice, bird, even the pet dog. Okay, so even the squirrel may be the host of the tick. Okay, and that tick carries the Borrelia Burgdorferi. That is the cause of the Lyme disease. Okay. Incubation period is 3 to 30 days. About 80% infected people develop erythema migrans. This looks like a bull's eye within 30 days of exposure. Erythema migraine is red, expanding rash with or without central clearing. Okay. So erythema migraine is often accompanied by symptoms of fatigue, fever, headache, mild neck rigidity, joint pain, muscle pain, myalgia, arthalgia, neck rigidity. Infection can spread to other part of the body over days or weeks. Neurological complications include meningitis. There is inflammation of the meninges, dura mater, arachnoid mater, pia mater. Radiculopathy, there is the pathology along the spinal nerve roots. And facial palsy, there is the paralysis of the seventh cranial nerve. Cardiac complications include myocarditis and atrioventricular heart block. Untreated infection progress to monoarticular or oligoarticular arthritis, peripheral neuropathy, or encephalopathy. Okay, so this is the image I have taken from Microsoft PowerPoint. Okay, this is also from Microsoft PowerPoint. Creative Commons. Early stage will get fever, chill, headache, fatigue. Then will get bull's eye appearance. There may be some neurological problem here, irregular heartbeat, facial palsy. This is the tick, heart tick with black leg. Okay, if you go there, adult female drops the egg becomes six-legged larva. Okay, larva feed on first host and acquire Borrelia, and first host include the white-legged mice, squirrel, and birds. Okay, then that nymph infect nymph, feed on human and transmit Borrelia. Again, nymph feed on second host, may acquire Borrelia also from here. Nymph molt into adult. Adult tick will be on the skin of the deer. Okay, so adult feed on dogs and human and transmit Borrelia. So Borrelia may be transmitted by the nymph, by the adult tick, but mostly by the nymph stage. Okay, this is the erythema migrans on the thigh. The patient is the son of one of the writer of this book, Medical Microbiology 7th edition. This is a late stage of Lyme disease, acrodermatitis, we are seeing that, atropicans, bluish red skin lesion characteristic of late disseminated manifestation of Lyme borreliosis. Okay, we'll go to the diagnosis of Lyme disease. Clinical case definition: observation of erythema migrans rash with a history of hiking or traveling to the endemic area with or without a history of tick bite. The nymph stage is only 2 millimeters, so it may not be readily identified. Adult form is large, around 5 millimeters, that can easily be taken out. Okay. For patients with musculoskeletal, cardiovascular, neurologic manifestation, this and these. One of these are the clinical case definition. Okay, erythema migrans plus other manifestation, musculoskeletal, cardiovascular, neurologic. Laboratory diagnostic criteria: isolation of Borrelia Burgdorferi. This is not always possible. Diagnostic level of IgG and IgM to the spirochete. Two-tiered serologic testing consisting of ELISA, IFA, and confirmatory Western blot is recommended. Lyme disease is a notifiable disease. Okay, so what is the treatment? What is the treatment? We got the treatment here. Okay, so treatment depends on the disease stage. Initial stage treatment is oral doxycycline, maybe 100 milligram 2 times daily for at least 4 weeks. It may be 8 or 12 weeks depending on the disease condition and the best assessment of the licensed doctor to treat Lyme disease. So oral doxycycline. The late stage, we also like the intravenous ceftriaxone in lieu of doxycycline. This is the drug for the late stage. Prevention is very important. Avoid tick habitat. Use insect repellent on exposed skin or clothing. Carefully checking the attached tick. Wearing long sleeve shirt or pants. Close shoes. Tucking the shirt to the pant and the pant to the socks. So there should be good tucking so that the tick cannot get in. Okay, and that's all about the Lyme disease. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Please share the information with your friends. And again, have a nice day. Be safe and content. Bye now.